Well, earlier tonight I spoke to the leading British fertility expert, Lord Winston. I began by asking him his thoughts about this procedure.
Well, I think it's really interesting. I'm very glad that they've done it. It seems an important thing to have done. It's not entirely new because, of course, actually the technology is British. It was first done in Edinburgh by David Baird and Roger Gosden quite a long time ago in sheep. And then since then, an American surgeon has done some of this work, but not for a cancer victim. So, although it was always recognised that cancer victims might be an ideal opportunity, this is new in that respect. And the reason why it's possible is because the ovary, which is a sphere, has a skin which is absolutely chock full of eggs. The interior doesn't have many eggs, but the skin of the ovary is full. So if you can just peel off a bit of the skin and then freeze that and replace it later on, you do have a probability of being able to get that to ovulate.
I mean, one has heard before of people going in for treatment being told that they should save some eggs, as it were. So that has happened, but not for cancer before.
Yes, but not for cancer. The trouble really is that egg freezing is not a very attractive technology because it's not easy to do. It requires much more fiddling around than this does, because this is a pretty simple procedure. You can do it any stage during the menstrual cycle. You don't need to prepare the patient with drugs, and you do a laparoscopic examination. That's a telescope through the abdomen, and you take a piece of the ovary away. The problem with it is that in taking the bits of ovary away, you may scar it and therefore cause infertility at a later date. But it seems to me that if you're suffering from cancer, you want to try everything to try and restore your fertility. And I know from experience of many people who've got cancer problems that they're actually more worried about the fertility issue when they've had the drugs afterwards than the radiation. That's the thing which frightens them, because people with cancer nowadays expect to live. I mean, rightly, of course, but the consequences of the treatment, the side effects of the treatment, which are often causing sterility, are very serious, both to men and to women.
I mean, why is it that cancer treatment can cause sterility?
Because the eggs in the ovary are very sensitive to radiation, and they're very sensitive to the drugs which are given to developing cells. And of course that applies to males as well. So what happens in the ovary will also happen in the testes.
But we're not just talking about people who have cancer of the testes or cancer of the womb. I mean, we're talking about people who have cancer in general.
Indeed, but nowadays more cancer is treated by drugs. And of course the drugs affect you systemically, that's the whole body. So if you were having lung cancer treatment or liver cancer treatment or brain cancer treatment, the probability is you might be having chemotherapy which would affect your ovaries or your testes.
That would also affect your fertility.
Yeah.
And are there any ethical problems with this?
I think the ethical problems which really will need to be teased out are whether or not you might cause an abnormality in the baby. But actually I think really the probability is you'll prevent abnormalities, because of course one of the issues with chemotherapy is that by treating somebody whose eggs then recover, you may actually induce an abnormality because they were not protected by being removed from the environment which caused the disturbance. So that's one problem. The other issue which has been talked about for some time is that if you take a piece of ovary away, you may take some cancer cells. So when you replace the ovary, you might replace some cancer cells which then regenerate. I think it's probably a theoretical objection.
And of course the other thing is that the woman has to have enough of her body left that she can then grow a baby.
Yes, and it's only going to be really valuable for teenagers, probably, maybe younger people occasionally, and for young people who get cancer. But of course, cancer is now such a disease that really it's not unusual. We're treating more and more young people with those diseases successfully, so they're living longer through childbearing life.
And you say that this technology started in this country. It's now been conducted
a long time ago
on a woman. Do you think this will now become fairly widespread?
I hope it becomes more widespread. I think one of the real issues is that sometimes people treating cancer and sometimes people being treated by cancer are so consumed by the anxieties of what's going to be facing them that fertility is rather forgotten about. And certainly in the past, one of the issues has been that oncologists have not really perhaps rated the preservation of fertility seriously enough. I think the advantage of this technique is that it's a pretty quick intervention. It doesn't require a great deal from the patient. It does require an anaesthetic. But providing they're well enough to have an anaesthetic, which of course most cancer victims certainly will be, then I think you can then store these eggs almost indefinitely.
And potentially what sort of numbers of women are we talking about?
I don't know. At Hammersmith Hospital, when I was working there, we probably saw about somewhere between 100 to 150 patients in 5 years who were looking at having their eggs stored.
Professor Winston, thank you very much.